Sam, thank you. Well, many of our active duty and military veterans face mental health struggles, but there are resources out there to help. Joining us to talk more about this, psychiatrist Carla Schnitzlein. Thank you so much for being with us today.
Thank you so much for having me. I appreciate being here.
Well, let's get right to it. What are some of the common mental health issues that these active duty and military veterans are experiencing?
Absolutely. So similar to our civilian population, we see a lot of depression. We see anxiety. Of course, with the most recent conflicts in Iraq and Afghanistan, we've seen a lot of post-traumatic stress disorder and symptoms related to that. And with those conflicts, we've also seen traumatic brain injury, which can complicate any of those other conditions. And we know that both our active duty service members and veterans do struggle with substance-related issues, which can be more symptomatic of those conditions I just mentioned. The other thing I'd say is that because there's a lot of change throughout the military life cycle, coming into the military, changes in duty station, then later transitioning from the service, there can be a lot of anxiety with that. And if our soldiers and service members aren't well prepared for these life changes, that can create a lot of mental health issues of its own.
And how has COVID impacted these issues? Obviously, we've heard that quarantining has been pretty difficult on those with mental health issues. Put some of these combined issues, how has it affected them?
Yeah, so let's talk about the active duty side of things first. So right before I transitioned out from Fort Stewart, where I was with 3rd Infantry Division, we saw pre- and post-deployment quarantines to keep soldiers and their family members safe and healthy. But that's a period of isolation right before or right after a very stressful incident, which can worsen mental health issues and reduce that feeling of connection to family and friends. And certainly our veterans who would normally have resources, groups they attend for mental health issues, the VFW, places where they'd find support, don't have as ready access to that because of social distancing requirements. And that can make the strain of mental health diagnoses that much worse.
And you are presenting a webinar on this topic, and a lot of people, families and friends, can learn a lot about it. Tell us a little bit more.
Absolutely. So just in terms of how families and friends can help is biggest thing, recognizing symptoms and signs when a loved one who's either served or is still serving are struggling. So changes in behavior, maybe some sleep issues can be the tip of the iceberg for that. And then just knowing what resources are there, whether it's through the Veterans Administration, whether it's through places like Hartford HealthCare, being able to get connected when you identify there's a change.
Okay, Dr. Carla Schnitzlein, again, you are going to be taking part in this webinar, and people at home, they can see it here on their screen. To register, you just head to hartfordhealthcare.org/virtual classes. Of course, we'll have all of this information over on WTNH.com as well. Thank you so much for taking the time to talk with us today.
Of course, thank you.